Orthostatic hypotension, also known as postural hypotension, is characterized by a decrease in blood pressure that some individuals may experience upon standing up. This sudden drop in blood pressure can lead to sensations of dizziness or lightheadedness, and, in severe cases, even result in fainting. Symptoms of orthostatic hypotension typically manifest when transitioning from a seated or lying position to a standing one and may encompass sensations of lightheadedness or dizziness, blurred or dimmed vision, a sense of weakness, fainting, or loss of consciousness. Orthostatic hypotension can arise from various factors, including insufficient fluid volume in your blood vessels, which may occur due to blood loss, dehydration caused by inadequate fluid intake, severe diarrhea, vomiting, or excessive sweating, such as during physical activity, inadequate blood pumping by the heart, dysregulation of nerves and hormones responsible for blood vessel control, use of specific medications that can trigger orthostatic hypotension, such as those prescribed for high blood pressure, angina, chest pain related to heart disease, or depression. Additionally, some individuals may experience orthostatic hypotension as a consequence of underlying conditions like diabetes, nerve damage, or Parkinson's disease. However, it's important to note that even otherwise healthy individuals, particularly older adults, can develop orthostatic hypotension. Is it advisable to consult a healthcare professional? Yes. If you frequently experience sensations of dizziness or the feeling that you might faint when transitioning to a standing position, it's recommended to seek medical advice. If you ever do lose consciousness, faint, be sure to inform your doctor. Are there diagnostic tests for orthostatic hypotension? Indeed, there are several tests available to assist your doctor in determining if orthostatic hypotension is the underlying cause of your symptoms. The most straightforward test involves measuring your blood pressure and pulse while you are seated or lying down, followed by measurements after you stand up. Additionally, your doctor may recommend other assessments, including blood tests to assess for a condition known as anemia, characterized by an insufficient number of red blood cells. Blood tests to verify the appropriate chemical balance in your blood and ensure that your fluid levels are within the normal range. Assessments to confirm the proper functioning of your heart. Treatment typically begins with addressing the root cause of your orthostatic hypotension whenever feasible. For instance, if dehydration is the culprit, your healthcare provider may recommend rehydrating by drinking water to replenish lost fluids. If your symptoms aren't related to dehydration, your doctor or nurse will investigate whether certain medications you're taking might be contributing. In such cases, they may consider changing your medication or adjusting the dosage. Additional treatments are available to alleviate your symptoms, including dietary adjustments. Some individuals may benefit from dietary changes, such as increasing salt intake and staying well hydrated. Lifestyle modifications. These may involve altering sitting and standing habits, practicing gradual changes in posture, or avoiding hot and humid conditions. Wearing compression stockings or abdominal binders. These devices apply pressure to specific areas of the body and can be helpful for certain types of orthostatic hypotension. Compression stockings, particularly those that extend to the waist, can provide relief, although they can be somewhat challenging to put on. Abdominal binders are worn around the belly. Medications for direct treatment. If other interventions prove ineffective, your healthcare provider may prescribe medications designed to specifically address orthostatic hypotension symptoms. You may need to explore multiple medications to find the most effective one for your case. Indeed, there are several measures you can take to help mitigate the challenges posed by orthostatic hypotension. However, it's crucial to consult with your healthcare provider before implementing these strategies. Here are some suggestions. Practice gradual posture changes. When transitioning from lying down or sitting to standing, do so slowly and allow your body time to adapt. This is particularly important when you wake up in the morning. Adjust your eating habits. If you experience symptoms after meals, consider making dietary changes. Manage heat and sweat. Limit activities that might cause overheating or excessive sweating, such as hot showers, strenuous exercise, or hiking. Stay well hydrated, especially in hot weather. Elevate the head of your bed. Use extra pillows or an adjustable bed to slightly elevate the head of your bed. This can help raise your head above your heart, potentially reducing orthostatic hypotension symptoms. Limit alcohol consumption. Avoid consuming excessive amounts of alcohol as it can exacerbate orthostatic hypotension. Please remember to consult with your healthcare provider before implementing these suggestions to ensure they are appropriate for your specific situation.